India has the largest number of preterm born babies. The WHO has shown that in India and some of the Southeast Asian countries, premature births are very common, and these premature babies have a very high mortality, that is, they die very early. So, to prevent this, there are a lot of NICUs and special care newborn units which the government and private sector have set up, so that we do not lose these babies. So, a lot of effort is going into not only the pregnancy, which may be a test tube baby, what we call as IVF, or assisted fertilization babies, or otherwise preterm babies. So, they are being kept in incubators or in newborn care units, where a lot of attention is paid to weight gain, health of the baby, so that these babies survive. So, what is important to know from the eye point of view is that these babies who are preterm, they can get a very serious eye problem called as ROP, retinopathy of prematurity. So, what is this retinopathy of prematurity? Because it is somehow a new disease, although it has been described since 1940s in the western world, because we did not have this high end SNCUs and NICU care in India, we were not seeing much of this disease. But for last 20 years now, we have seen that ROP blindness is rapidly increasing, because many people are not aware of this disease. So, I want to just tell the parents and the doctors and nurses who take care of preterm babies something about ROP. So, ROP is not there since birth. At birth, the eye looks to be normal from outside, it seems as if the child is seeing or child has normal eye, but the normal eye grows only at 40 weeks, that is the normal pregnancy is 40 weeks of pregnant life of a baby. That is, at the end of pregnancy 40 weeks, that is 9th month, the eye starts completing its development. So, babies who are born early, their retina, that is the inside of the eye, which is like the film of the camera, the retina tissue, this has not grown fully, it is only partially grown. Over the next few weeks between the birth and say 40 weeks of gestational age, this retina grows slowly. But in some babies, which is about 15 to 20% of babies, the retina does not grow normally. It starts growing haywire, it starts getting bleeding inside the eye, and the retina starts detaching, and all these things are happening while the baby is under care of parents and doctors, but there is no sign outside. From outside, the eye looks totally normal and there is no pain or redness. So, you cannot make out that some disease is smoldering or going on inside the eye, which is destroying the baby's vision very rapidly in few weeks. So, what we want to say is time is vision. Within 20 to 30 days of birth, the preterm baby's retina must be examined by an eye specialist. If the baby has been discharged, then immediately after discharge, we should take the baby to eye specialist and get the retina checked. If the baby is not discharged, is still in the hospital, then the eye specialist should be brought to the hospital, and with the indirect ophthalmoscope or with the camera, the eye specialist should check the baby. Now, this checking of the retina is not one time, it has to be checked again and again every 7 to 15 days till we are sure that the vision is there and the retina has fully developed. So, what happens is sometimes the parents, they get one eye checkup done and then they do not talk to the doctor, they do not try to find out when is the next checkup, and they miss the next checkup. If you miss one checkup, then by the time you go for the second checkup, the retina may already have detached, and once the retina detaches, then there is no looking back. It is just like if we do not give polio drops and the baby gets polio to the leg and the leg is deformed, now no treatment in the world is going to get back that normal leg which the child was born with. Same thing happens in ROP. If the ROP retina detaches or there is bleeding inside the eye which is severe, then there is no treatment in the world which is going to get it back. So, it is very important to check the retina and take treatment. So, there are 3 steps. First is 30 दिन रोशनी के or 30 days to vision. Make sure that the retina checkup of the preterm baby is completed within 20 to 30 days of life. That is the first checkup. Second step, follow up. Follow up this baby every 15, 20, 25 days, sometimes even every 3 days, till either the disease is treated or the retina grows. Third step, if the disease is going haywire, treat it immediately, usually within 24 to 48 hours with laser, and sometimes if laser does not work, immediate vitrectomy surgery, and sometimes we have to give injection also in the eye. So, whatever treatment is required, it has to be done in acute phase and keep a very close watch so that the disease goes off before the child reaches its due date, that is expected date of delivery. The complete treatment should be over usually by 40-41 weeks of gestational age. Now, what are the factors which can worsen? So, of course, the premature delivery, that is any child who is born less than 34-35 weeks of pregnancy, that is about 5-6 weeks before due date, or was less than 2 kg, or had any treatment required in the NICU, all these babies are at risk. they must have retina checkup done. Now, there are other factors which can worsen this ROP. One of the very important factors is weight gain. Those babies who don't start gaining weight rapidly, they are more at risk. Babies who have breathing problems, lung problems, nasal blockage, chest problems, they can have more worse ROP. So, those things need to be taken care of. Then anemia, if the baby has low hemoglobin, then the ROP can worsen. So, correction of anemia with proper iron supplement or blood transfusion, again very important. The most important risk factor is also oxygen. Even babies who have got no oxygen, they can get ROP, but if they get oxygen and it is not monitored properly or delivered properly by blending, then they can get ROP. So, oxygen is essential, because if we don't give oxygen, baby can die or can get brain damage. But if we give too much oxygen or unblended oxygen or improperly given oxygen, then also the ROP can worsen. So, all this quality care of the newborn has to be done within the first 2, 3, 4 weeks of birth, so that the eye development is good and the eye is monitored very regularly. See, I always believe that, if the child has some stomach problem, feeding problem, heart problem, lungs problem, it will all show up. The parents, the sisters, nurses, the doctors, they will know the child has some abnormality and we need to take care. But if the child has blurred vision, there is nothing from outside that you can know the child is seeing blurred. Just take off your glasses and see how you see. From outside, nobody will know that you have an eye problem, but you know that you can't see clearly. So, the child cannot express that it is seeing blurred, and we will know only that child has problem when he starts going to school or when he starts walking, and we notice that child is having eye poking behavior, pressing the eye, or child's eye is shaking, or it is not having eye contact, it is not looking at us. But by that time it is too late. That is in advanced stage of ROP. In early stages, the eye will look perfectly normal from outside, and you may feel that child is seeing well. So, irrespective of whether child is looking normal, the eyes are looking normal, child is smiling, we must do retina screening and retina checkup to see what is actually happening inside the eye, because the disease is silent. So, I think this message will go to all the parents, grandparents, doctors, nurses, healthcare workers, that to achieve good vision, in newborn babies requires very close observation and examination of the retina of preterm babies, and follow up and careful treatment by specialists, so that at the end of the day the child sees very well. Time is vision, 30 days to vision, 30 दिन रोशनी के. Just remember this slogan and follow it up.